We are standing on the precipice of a healthcare revolution. The advancements in technology and the integration of digital tools are reshaping the landscape of medical care. This transformation is not just about new gadgets or software, it's about fundamentally changing how we approach health and wellness. The way we access and experience healthcare is rapidly changing. From virtual consultations to remote monitoring, patients now have more options than ever before. This shift is making healthcare more accessible and convenient for everyone. No longer are we limited by physical boundaries. Patients can connect with specialists from around the world, breaking down barriers that once seemed insurmountable. Technology has opened up a world of possibilities, from AI-driven diagnostics to wearable health monitors. The tools at our disposal are more powerful and sophisticated than ever. At the heart of this transformation is telehealth. This innovative approach allows patients to receive care without leaving their homes, making it easier to manage chronic conditions and follow up on treatments. It's changing the way doctors provide care and how patients receive it. Telehealth is bridging the gap between healthcare providers and patients, ensuring timely and efficient medical attention. This shift is also profoundly impacting the healthcare workforce and how it's structured. Medical professionals can now collaborate across distances, sharing expertise and resources in real time. Imagine a world where geography is no longer a barrier to specialized medical care. Patients can access top-tier medical advice and treatment regardless of their location. Imagine a world where patients in rural areas can access the same level of care as those in major cities. Telehealth is making this vision a reality, bringing quality healthcare to underserved communities. This is the promise of telehealth. It's about creating a more equitable healthcare system where everyone has access to the care they need. This essay will delve into the transformative world of telehealth. We will examine the technologies driving this change and the benefits they bring to both patients and healthcare providers. We will explore its impact on healthcare staffing contracts, the challenges it presents, and the exciting future it holds. Join us as we navigate this new era of healthcare, where innovation meets compassion. Telehealth, at its core, is the delivery of healthcare services remotely. It uses technology to bridge the gap between patients and providers. This can take many forms: a virtual consultation with your doctor, remote patient monitoring of vital signs, even specialized surgery performed with robotic assistance from miles away. These are all examples of telehealth in action. Telehealth encompasses a wide range of services. These include live video conferencing for real-time consultations, asynchronous communication through secure messaging platforms, remote patient monitoring using wearable devices, and transmission of medical images for remote diagnosis. Telehealth allows us to rethink traditional healthcare models. It enables us to deliver care more efficiently, conveniently, and accessibly. The COVID-19 pandemic was a watershed moment for telehealth. Faced with lockdowns and social distancing, both patients and providers turned to telehealth as a safe alternative. This rapid adoption accelerated the growth of telehealth exponentially. What was once seen as a niche service became a lifeline for millions. But the rise of telehealth is more than just a pandemic response. It's about recognizing the inherent value of remote healthcare delivery. The convenience for patients, the cost savings for providers, and the potential to improve health outcomes. These factors will continue to drive the growth of telehealth long after the pandemic has subsided. The widespread adoption of telehealth is reshaping the healthcare workforce. Traditional staffing models are being challenged as new opportunities and demands emerge. Healthcare organizations are now looking for professionals with expertise in telehealth technologies. Nurses skilled in remote patient monitoring, doctors comfortable with virtual consultations, and technicians proficient in digital health platforms are in high demand. This shift is also impacting healthcare staffing contracts. We're seeing a rise in remote work arrangements, flexible scheduling, and geographically agnostic hiring practices. The traditional model of healthcare professionals being tied to a specific location is being challenged. Section 5. The Digital Toolkit Powering Telehealth. The telehealth revolution is powered by a suite of digital tools and technologies. These innovations are transforming the way healthcare is delivered, making it more accessible and efficient. These tools enable seamless communication, data exchange, and remote monitoring between patients and providers. They bridge the gap between physical distance and healthcare needs, ensuring that quality care is just a click away. Electronic health records, or EHRs, provide a comprehensive view of a patient's medical history, including past treatments, medications, and allergies. This allows for informed decision-making during virtual consultations, as doctors have all the necessary information at their fingertips. Secure and HIPAA-compliant video conferencing platforms facilitate real-time interactions between patients and providers. These platforms ensure that patient privacy is maintained while enabling effective communication. Wearable sensors and other connected devices, known as remote patient monitoring devices, are revolutionizing patient care. They allow for continuous monitoring of vital signs, medication adherence, and other health indicators, providing real-time data to healthcare providers. Mobile health apps empower patients to actively manage their health. These apps offer a range of features, providing access to educational resources, appointment scheduling, and secure communication with their care team. They also offer reminders for medication and follow-up appointments. These digital tools are constantly evolving, adapting to the changing needs of healthcare providers and patients. They are becoming more sophisticated, user-friendly, and integrated into the fabric of healthcare delivery, ensuring that telehealth remains a vital component of modern medicine. Section 6. Navigating the challenges, pay, licensing, and staffing in the telehealth age. While the benefits of telehealth are undeniable, the transition is not without its challenges. The rapid shift to virtual care has brought to light several critical issues that need to be addressed to ensure the system's efficiency and effectiveness. One of the most pressing issues is ensuring fair compensation for telehealth services. Healthcare providers need to be adequately reimbursed for the time and resources they invest in virtual consultations. Historically, reimbursement rates for telehealth services have lagged behind those for in-person care. This discrepancy can discourage providers from fully embracing telehealth despite its potential to improve patient access and outcomes. This disparity needs to be addressed to incentivize providers to adopt telehealth and ensure its long-term sustainability. Equitable pay structures will be key to fostering a robust telehealth ecosystem. Another challenge is the patchwork of state licensing requirements for healthcare professionals. Each state has its own set of rules, which can be cumbersome and time-consuming for providers to navigate. This can create barriers for providers who want to practice telehealth across state lines. The complexity of obtaining multiple licenses can deter healthcare professionals from offering their services to a broader patient base. Streamlining licensing regulations will be crucial to maximizing the reach and impact of telehealth. Simplified processes and interstate agreements can help break down these barriers, making it easier for providers to deliver care wherever it's needed. Finally, addressing staffing shortages in certain areas and specialties will be paramount. The demand for healthcare services is growing, and telehealth can play a significant role in meeting this demand. Telehealth can help bridge these gaps by connecting patients in underserved areas with specialists located elsewhere. This can be particularly beneficial for rural communities that often lack access to specialized care. However, proactive workforce planning and investment in training programs will be essential to meet the growing demand for telehealth services. By equipping healthcare professionals with the necessary skills and resources, we can ensure that telehealth continues to thrive and evolve. Section 7. The future unfolds. Telehealth's impact on healthcare staffing. The future of healthcare staffing is inextricably linked to the evolution of telehealth. We can expect to see continued growth in remote work opportunities, flexible scheduling arrangements, and geographically agnostic hiring practices. The demand for healthcare professionals with expertise in telehealth technologies will only intensify. This includes nurses skilled in remote patient monitoring, doctors comfortable with virtual consultations, and technicians proficient in digital health platforms. Healthcare organizations will need to be agile and adaptable in their staffing strategies. They will need to embrace new technologies, invest in training programs, and create work environments that attract and retain top talent in the digital age. Section 8. Embracing the telehealth revolution. The telehealth revolution is here. It's transforming the way we deliver and receive healthcare. While challenges remain, the potential benefits are too significant to ignore. By embracing telehealth, we can create a more accessible, equitable, and patient-centered healthcare system. A system that empowers patients to take control of their health and connects them with the care they need when they need it, regardless of where they live. This is a future worth striving for. Section 9, a call to action shaping the future of healthcare together. The telehealth revolution is not something that will happen to us. It's something we must actively shape and mold together. Patients, providers, policymakers, and technology companies all have a role to play. We need to advocate for policies that support the expansion of telehealth, ensure fair reimbursement for telehealth services, and streamline licensing regulations. We need to invest in the development and implementation of cutting-edge telehealth technologies, and we need to prepare our healthcare workforce for the demands of this new era of digital health. The future of healthcare is in our hands. Let's work together to create a healthcare system that is as innovative and dynamic as the world we live in.